gasping to breathe. This is the front line of India's battle against Covid. There are 1,600 beds at this hospital, but still nowhere near enough to meet the rising demand.
I have never seen so many people dying in front of our hospital.
Doctors are confronting insurmountable odds. For those like Ravikant Singh, the fight against Covid is also putting his own life at risk.
So Dr. Rajat is positive, his mother is positive, his daughter is positive, my mother is also positive. So we have to fight battle at the family level also.
Oxygen is hard to find, but patients keep coming.
So we're outside Pentiment Hospital, one of the dozens of smaller hospitals in New Delhi. Now they've completely run out of oxygen for today. In fact, the most critical patients have been asked to leave. Now this hospital, like so many others in New Delhi, is not functioning on a day-to-day basis, but on an hour-to-hour basis. So acute is the oxygen crisis in this city that people are willing to pay almost anything in order to have some oxygen for their loved ones.
Some driving hundreds of miles across India to get it. Shivam Chaudhary supplies oxygen to about 30 hospitals in East Delhi. His phone hasn't stopped ringing.
I am receiving around 5,000 calls per day. They are all lowering me with the money that please give me the cylinders and we are ready to give you n number of money. They are ready to give me the key of the vehicle, but still I am saying I cannot give you the supply.
A thriving black market has sprung up on and offline for oxygen, with people willing to pay as much as £192 for a cylinder that ordinarily costs about £6. As we film, more and more people arrive begging for help for sick relatives. Some dare to voice their concerns about the lack of government help.
ऑक्सीजन नहीं मिल रही है, हाथ जोड़ के मोदी जी वोट दिया, देश के हैं, देश के वोट दिया आपको, कुछ तो करो, मेरी मां मरने वाली है.
Today, a High Court judge gave his damning verdict. Officials who allowed rallies like this for West Bengal's regional elections should be booked for murder. And having dismissed scientific concerns of a rising tide of cases, apparent contrition from Mr. Modi.
कोरोना की पहली वेव का सफलतापूर्वक मुकाबला करने के बाद देश हौसले से भरा हुआ था, आत्मविश्वास से भरा हुआ था, लेकिन इस तूफान ने देश को झकझोर दिया है.
वैक्सीन खत्म हो गए, प्लीज सब लोग बाहर आ जाइए, पुलिस को कोऑपरेट कीजिए, सभी से निवेदन है प्लीज पुलिस को कोऑपरेट कीजिए.
This is what Mr. Modi is relying on, vaccines. But they are in short supply. India's Serum Institute is one of a number of global leaders in vaccine production in the country. Yet, just 10% of over 45s have been vaccinated. That hasn't stopped the government promising to expand the vaccination drive to now give the jab to anyone over 18. But it's a move that comes too late for many thousands of people whose deaths have yet to be counted.
Well, the actual number of COVID-19 deaths in India is under dispute. There are fears that cases are being undercounted as infections surge through the country. The latest official figures show around 17 million coronavirus cases have been recorded so far. And for the fifth day in a row, the Indian government has reported more than 300,000 infections, a world record. But experts are predicting COVID cases could reach at least 500,000 a day in the coming weeks. According to the official total, 195,123 people have died with COVID-19 in India. But experts fear the real figures are much higher.
Well, to discuss those figures and the emergency, I spoke earlier to one of India's leading virologists, Professor Shahid Jamil, and I started by asking him about the rates of infection they're dealing with at the moment.
Well, the numbers that we are getting are roughly 350,000 cases per day. It's possible that the actual numbers are higher, but I have no reason to believe what those numbers might be. Even at this number, I think we are completely overwhelmed by now. The hospital capacity is full, and there are all kinds of shortages of oxygen, medicines, hospital beds. So we are really dealing with a very, very strong surge at this time.
And do you think we're anywhere near the peak?
So in India, yes, the numbers are predicted to increase for the next 2-3 weeks till it reaches a peak, and then the numbers will come down.
What sort of number of infections will there be by the time it peaks?
The numbers of infections at peak are predicted to be somewhere around 500,000 to 900,000 per day.
And when you talk about the number of cases, do you have any sense of what proportion of those end up dying?
Well, if you look at the official figures that are dying, the formal death rate right now is roughly 2,500 deaths per day, which I think is severe undercounting, not because of some design to do so, but simply because the way COVID deaths are measured. But the rate at which this outbreak is expanding is quite phenomenal. It's growing at the rate of roughly 7% every day.
You're a virologist. What can you
Yes.
do you think, to stem this disaster?
Well, what I can do is tell people not to worry about this mutant or that mutant, this variant or that variant. Every single variant is stopped by a good mask. So masking has to be done 100%. There is no compromise with that. And if we mask up, we are going to break this chain of transmission.
But we know that people are massing together for religious festivals. We know that people are meeting in huge groups and the rest of it. That behavior in India is not fundamentally changing.
This is where the government should really step in and shut down these events. That's the only way. I mean, having a lockdown in cities like Delhi or Bangalore or Mumbai will help. But, these events, the election campaigning, the election rallies and the festivals need to stop. Otherwise, we are taking the virus to all parts of the country.
Are you more anxious now than at any time in your career?
Absolutely. Absolutely. No doubt about it.
What is the main reason for your anxiety?
In the last 1 week, at least 10 people that I knew closely have died. And they've all died of COVID. So I've not seen anything like this happen ever in my life.
Professor Jamil, thank you very much indeed for talking to us. And I'm sorry for your loss.
Thank you very much.